Hello ladies and gentlemen, welcome back to another episode of Simplified Radiology. Today's topic is age of blood products on MRI. Is it too much information to remember? Well, let's try and simplify it. Now this table is very important, not just for daily practice but also for exam point of view. A question on it is a must. The question can ask anything. For example, it might give you the age of bleed and ask about signal intensities, or it might give you the signal intensities and ask you what hemoglobin product is responsible for it. In short, the question will give information from any one of the columns and ask you about corresponding features of any of the other columns. So let's begin with the first column. The bleeds are categorized as hyperacute, acute, early subacute, late subacute and chronic. Now there is no mnemonic for it as far as I know, so I created one for myself, and it goes like this. Hens are egg-laying chickens. Sounds silly but does the trick. Hen stands for hyperacute, R stands for acute, egg stands for early subacute, laying stands for late subacute, and chicken stands for chronic. So far so good, right? Now this next column, unfortunately you'll need to memorize. Now for the third column. Hemoglobin degradation products. We can remember this by imagining a person stuck in a tight space with no ventilation. At first stage the person has some oxygen reserves to stay alive. This stage is oxyhemoglobin. At second stage, when the reserves are depleted, there is no more oxygen. This stage is the oxyhemoglobin. At third stage the person would die without oxygen. In other words, patient mortality would occur. So just like a dead person cannot use oxygen, similarly at this stage methemoglobin forms where iron in the heme changes from +2 to +3, which cannot bind to oxygen. Remember it like this: M for mortality, M for methemoglobin. At the fourth stage, since the person is dead, the body would start to decompose and the insides would be exposed to the environment, changing intracellular methemoglobin to extracellular methemoglobin. At the final stage, decomposition would continue. The hemoglobin consists of a heme group and a globin group. Globin, being organic protein, would decompose as well, leaving behind just heme. This accumulated heme would form hemosiderin. Now for the last column, a mnemonic already exists for T1 and T2 signal intensities, which is quite handy. It goes like this. I bleed, I die, bleed die, bleed bleed, die die. I being isointense. Bleed being bright or hyperintense. Die being dark or hypointense. Each pair of words corresponds to one stage. So this concludes our topic. This is how it all seems on imaging. I hope this helped you learn the table better. Please like and subscribe. See you next time. Bye.